Welcome to this session of our Gender Community of Practice. I am Lena Arnold Fritsch. I'm a Development Support Manager at Hub Cymru Africa, and I facilitate the Gender Community of Practice to provide a supportive environment for shared learning and experience. There are about 3 sessions per year on various topics, and today we will again talk about menstrual health. So as we did back in November when we had quite a broad session on this, and what's become clear, I think, is that it is a very complex and multi-sectoral issue affecting health, affecting education, gender, and human rights. And yeah, we could talk about it for days, really. Unfortunately, we don't have the time, but it felt appropriate to at least do a bit of a follow-up and provide more space to address some of the aspects and topics that seem to be of particular interest last time. So it will be more focused today. The session will be split into 2 parts to talk about context-specific products and materials, and also about funding and yeah, possibly sustainable approaches. This session will be chaired by Mariama Jeloba. If you were here last time, you will remember her. She was one of our speakers then, and she'll introduce herself in a minute, but she's a country representative at Urbond, an organization based in Guinea. And yeah, she's got extensive experience and expertise in this field. So best place to guide the conversation today, I think, and share some insights herself. Before I hand over, though, I'm going to go through a little bit of housekeeping. So, all right, if you could assist me with, or Emma, no, Emma, I don't think you're a host, with letting people in, that would be helpful. So this is just to go through a few ground rules. If you haven't done so already, please rename and put your organization to make it easier to identify for yeah, in the discussion and the Q&A. We're recording the session today for people who are not able to participate. That will be shared later on. We will also be sharing the slides and further resources after the session. If you don't have good connection, try turning off your camera. If you drop out, you can try rejoining through the Zoom link. Please mute yourself during the session to reduce background noise unless you're speaking. You can use the chat function to contribute comments or questions. You can also raise your hand to ask a question or yes, and we will pause at key moments to take these, but we may not have time to address everything. Yeah, we welcome and value everyone's contributions, but yeah, just to know that we want to prioritize our colleagues and partners in African countries. And so if we feel that the conversation is stuck, we'd like to have permission to interrupt to keep the conversation going. So please don't be offended if we do interrupt. It's about timekeeping. It is a short session today. So in general, I think I would say maybe we have about 2 to 3 minutes for individual contributions. So if you could keep that in mind, I appreciate it. Of course, it also depends on how many people will be there in the end. And yeah, so we have to be a little bit flexible. Please treat others with respect. This is a safe space for everyone. No form of abuse will be tolerated. We encourage challenging and constructive conversation, but people's lived experiences are not up for debate. If you have any serious concerns and need to make a safeguarding complaint, you can find information on SSAP's website, our host organization, about how to do that. Okay, so let's take a look at the agenda. As said before, there is 2 parts today. I think we've lost our chair. She's back, hopefully. Oh, tech issues. Okay, so the first part, both parts we have about 30 minutes for, and we'll start with talking about pad construction and yeah, materials. there is yeah, there's a range of options available using different materials, and we touched on that last time, so we're keen to hear more about different approaches. And then the second half is dedicated to the critical element of funding, which is naturally a matter of interest to many. So
Hello, Lena. Can you hear me, please?
yes, hi Mariam, are you back? Sorry, I can't really see the participants, but I did see that we lost you for a second. Are you all okay back in? Oop, I'm not sure. Um, Mariam, I'm not sure. I just heard you speaking, but
Yeah.
uh, are you back?
So sorry. I think my network is having some issues. So sorry.
That's fine. That's fine. We knew that was a risk. Okay, hopefully I could hear you now, so hopefully we'll be fine.
Hello.
Yeah, still issues, I think.
Hello.
Can you hear us, Mariam? Okay. Well, I hope it will stabilize again. Just to finish on the framing, yeah, we'll talk about in the second half, we'll talk about funding models, um, and obviously challenges around grant funding, as well as possibly strategies to tackle that. And again, I hope individuals are willing to share their experience and possibly tips. So we'll all leave with some insights on this today. I think it would be good to talk a bit more about social enterprise models. And I think we touched on those as well last time. And I know it's a widely used approach, but I'm sure yeah, a lot can be said about that in terms of um, appropriate conditions for it and potential risks and challenges with it. Okay. Um, and if there are other experiences with other funding models, we can touch on those as well. So the first part, before I hand over to Mariam, and hopefully that will work, I just wanted to provide a little bit of further framing and looking back at the last session as well. As mentioned, this is a follow-up from the last event. So these are some of the points and questions that came up last time. So we're not intending to provide any definite answers or solutions today, but it's an opportunity to continue the conversation basically and to share further learnings and exchange ideas and connect more. So so it's become clear that people use different methods and materials. Obviously, we can't cover them all. There's too many, but it would be interesting to look at a few contrasting options, and this may include some innovative approaches with biodegradable materials, because I think there was a question on this as well last time. Generally, would be great to hear what has worked in your context and what hasn't, or what learning you take away from that. We can discuss what sustainable menstrual products might be, what that means, reflecting on the ambiguity of the word sustainable. It can mean environmentally sustainable, but also financially, culturally, socially. Obviously, there's a bit of room for interpretation there. And the question is, how can we find trade-offs, I suppose, rather than perfect solutions? And of course, this also depends on the local context. And I'm sure there are other points to consider um, when choosing a material. Okay. Um, yeah, I think I want to leave it at that. That will be the second part and stop sharing. Although, if it's useful, we can put these questions here in the chat, some prompt questions. Yeah, I'll try to do that in a second. Okay. So I don't know. Do we have Mariam? Are you here? Are you with us? Can you hear me? Oh, that's not a good sign. Okay. I think we might have to improvise a little bit. I don't see her. at the moment. So, um, yeah, well, I was going to ask her to introduce herself. I did that a little bit, and I think um, it would be great to hear from her if she is able to rejoin. But um, we could start with someone else who has got experience on this. And I was thinking, I know that we have someone from the iRise East Africa Institute. I don't know, Lillian, are you still with us? 'Cause I think I saw your name before. And if you are up, I think we may have lost her as well. It's going great. Ah, yeah. Okay. No, I think she's not here either
I
at the
think
moment.
is it Barbara Namara is from iRise Institute.
All right.
Yes, good morning, good afternoon. How are you?
Hello. Hi.
I'm Barbara Namara and I'm Lillian's colleague.
Perfect. Oh yeah, I can see it now in your. Oh, that's great. Yeah.
Yeah, and I think I'd joined using her gadget, so I tried to rename.
Okay. Okay.
Thank you.
Great. Thank you so much for joining us. Yeah, it would be really great to hear from you about your experience about your method in particular and what yeah, whether it has proved effective. I'm sure it has. And what you feel is important to consider. Um, yeah, so maybe just to share a little bit about your work, if that would be fine.
It's okay, but I was not really meant to present. I'm reaching out to Lillian if she could join in and be able to present.
That's right. I don't think we have Lillian at the moment. That's right. You were okay. I'm sorry, I misunderstood. Okay. Yeah, I think she may have also had technical issues. Um,
But it's
okay.
okay, I could present, but maybe after one of the speakers, I could speak about iRise.
It seems like we have lost our speakers for the moment. So Mariam, our chair, had a plan to start by sharing some of her insights. And yeah, she dropped out. I think she must have technical issues at the moment. So I think I mean other people can of course also share if they feel comfortable to make a start. But otherwise, yeah, I'm very happy for you to share to just start if you're okay with it.
Okay, thank you. Lillian just sent me a message. She's trying to join in. I think her network is the main problem.
Hmm.
Yeah, but I could talk about a few of our work about IRIS, then she could do expand because I'm practically a new person. I work as a programs manager. I started 1 month ago, so I'm 1 month old in the office. Okay, IRIS Institute East Africa is a non-governmental NGO operating in Uganda and also in some of the different districts, where we're working to advance menstrual health, menstrual justice for all. We work in both schools, communities, and also national level. Our program thematic areas are in menstrual health education and pad distribution, where we work to provide information regarding menstrual health. This is in schools and also communities, where we identify different schools that vulnerable schools that girls are unable to access sanitary pads, and we're able to make them accessible and also affordable. So we provide information and also distribute pads at the same time. And the kind of the products we distribute, we have reusable pads. Uh, these are the ones that are made from Uganda, and also we have flow cups. Flow cups are used to support women during their menstruation, and they are from 15 years to and above. So these are practically for elder or for secondary students, and also women in the community. The other one is also the period panties. Period panties is a two-in-one. It has a panty at the same time as an inbuilt pad. These ones work mostly probably for children with girls with disabilities, depending on the disability, they might not be able to put on a pad, they might not be able to fix a floor cap inside, but they can just put on their panty, and they are very easy to wash. So you just soak in water and also change water and then dry. So they ease their work and so to make sure that they can achieve their potential without being limited by their periods. The other one is on, excuse me, is strategic policy and advocacy. Under IRISE, we use advocacy to advance our work through grassroots organization. We coordinated the period network in Uganda, and the period network covers East Africa and Uganda. That is Uganda, Kenya, Rwanda, Tanzania, and we are recently encroaching the West Africa to have more partners that are working on menstruation to have a platform to advocate for better policies and also for tax exemption. Recently, under IRISE, we work to promote to have a parliamentary forum that works on advancing menstrual justice. And originally it was not there, so we engage parliamentarians, and also we have an academy. The academy is a Menstrual Justice Academy, where we train young activists to on advocacy, on menstrual advocacy, to challenge the menstrual injustices, the norms, the taboos. And this year we are planning it. I'm calling upon partners to also participate in our academy to see also how it works. The other one is on the gender and women's economic development. And under this, we believe that when we have women who are economically empowered, they're able to also challenge. Through this, we have enterprises of young girls, of young women, the ones we trained on how to make better and standardized products. Yes, products, we're all fighting to have products accessible and affordable, but most of them might not be at up to standard and they might cause issues. So at Arise, we identified young women that have enterprises that are producing menstrual products like sanitary pads and knickers, where we worked with them and trained them in marketing, branding, and also brought into a Uganda Registration Bureau to train more on standardizing, on measurements, and also having a proper product. And these are the people that supply our products when we need, and also they do marketing. So they are achieving their goal, also making our work easier, making us sanitary pads accessible for vulnerable girls, but also affordable to girls, and also making a living for themselves.
Right.
Thank
Sorry to interrupt. Sorry, really sorry. That's a lot of information already. And thanks so much for sharing. Maybe just to come back a little bit more to the focus of today's session. So, we were wanted to focus it on really the materials and the pads itself, and you've definitely touched on that. And I think it's really useful to learn, how you're providing a range of products. It's great to hear. It includes cups and and panties, and basically also trying to suit the individual needs and preferences, of course. So I think that's really great to hear. Maybe, sorry if I and just to improvise a little bit. Obviously, I was hoping for Mariam's more and we've got Lillian back, so maybe she can support you with presenting your organization's approach as well. So maybe more specifically, before we go to other participants as well, what do you think is most important, like when choosing kind of the method, like choosing the material and the product for for the specific context? Like, is there anything you can say specifically about that?
I beg your pardon.
So I was wondering whether we could talk a little more about kind kind of important points to consider when choosing a method, choosing a material. So, the pad construction itself. So from I know you're new still. I don't know if Lillian is can hear us and is back, but maybe yeah. Hi Lillian. Thanks for your
Hi,
message.
Lena.
Hi. Do you think it's
I'm
possible
so
to?
sorry.
That's fine. That's fine. It's not the best day apparently for the network. If there's anything specific you can share from your yeah vast experience and expertise, I know that you have about points to consider in the context of pad construction and quality. We would be really interested to hear about that.
Okay, thank you so much. Good afternoon, good morning, everyone. Lillian Butler is my name. I work with iRise Institute East Africa. We are based in Uganda, and we do a lot of work around menstrual health and hygiene. So I'm honored, Lena, that you could think about me to share something or our experience. In terms of what you are asking about, in our context, for instance, in case of we are promoting so much reusable pads, first and foremost, for students in primary schools. Why? Because of the period that it takes for one to either have crossed to be able to finish the first primary level, which we consider like P7. And then when they go to secondary school, we start them on menstrual cups. And for children with disabilities, we do period parties. So that is briefly like the kind of products that we're using. In terms of standards, we have standards for reusable pads. And so government, we have an arm in government that enforces standards for all manufacturers, and they certify them to be able to produce. In Uganda, we have like a big company called like AfriPads, but then we have smaller ones that are coming up for young women. So as IRAs, we've been training them. Now we organize a training for them to be able to meet the standards in terms of measurements, in terms of knowing materials, where to outsource these raw materials from, but also the process itself from initiation to packaging and then to distribution. And at their level, we've been working mainly with three small young women organizations. But when we want like mass kind of supply, definitely we go to like the bigger capacity factory like AfriPad. So with the smaller organizations, we've been kind of encouraging them to work together so that in unity, they can be able to meet the market because the market is so big out there. But if they work in isolation, then they are not able to meet the demand, to know who is doing what where. Because like one is in Southwest Uganda, one is in Central, one is based in Karamoja, which is far east of Uganda. So in terms of the use, we emphasize also that kids, let me say from primary 5, or sometimes even 8-year-olds, we are having them start periods. So we are having education rolled out on products and how they can use the products effectively. And we have like a pool of trainers that do this. They've been trained to deliver menstrual health education, but also on product maintenance, product use, hygiene, including wash. So briefly, that's
Yeah,
what
that's
I
great.
can share. Yeah.
Thanks so much, Lillian. Yeah, just in the interest of time and giving others the opportunity. Yeah, I was wondering if anyone else would like to say something in relation to what Lillian has shared, maybe some of their own experience or even adding different points. Yeah, please feel free to come in if there's anyone. Okay, well, Emma put a question in the chat.
Yeah, there is a question, I think.
Yes, yeah.
On
Yes, exactly. So
standardization.
Emma says she's interested in the standardization of the pad construction, whether other countries have government standards, as in Uganda, and who sets the standards. Does anyone?
Yeah, okay, I can try, Emma. So in terms of Uganda, we have Uganda Bureau of Standards, which is in charge of all standardization of all products, let it be for food industry, for textile, or for pad. And so we've been recently undergoing a lot of training since 2024 on standards for pad production in Uganda. And that's how we got to know a lot on how they emphasize the quality, the measurements, and the material, the type of material, and then explaining to the young women who are doing the social enterprises on the certification process, what it takes for them to be certified, that their products meet the standards to be put on market. So the Uganda Bureau of Standards does that, but also across the different countries, because like in Kenya, in Tanzania, we have had several initiatives that have been coming up to try and meet the problem of access to menstrual products. So some of them have undergone different trainings with Young Water Solution, with a Springboard. In Rwanda, we had one. In Uganda, we had one enterprise, the one I'm talking about, based in Karamoja. Then in Tanzania, we had one. And in Kenya, there is one. So each country has standards, and you meet those standards. Now the question, last year we had a Girls Agenda Conference looking at how, as collaborators or partners, we are working around linking menstrual health to girls' education and what the challenges were. And some of the issues that came out of the producers of these pads was market crossing, like crossing borders, to have market in Kenya, to have market in Uganda, to have. So that is something that just came up, and I thought I could share. Thank you.
Thanks, Lillian. That's great. Does anyone else have any insights on standards in different countries? Oh, sorry, Tabitha, I saw you posted something in the chat. That's great. Yeah, I was wondering. Yeah, I'll share. That's a great resource. And I will share that in a follow-up email along with other resources. Thank you, Tabitha. Is there anything you want to say about it right now? Feel free to come in.
Just very briefly, I think it's quite amazing that actually there isn't any international standards for menstrual products at the moment, which, considering that they're used by half the world's population, is quite incredible. There's been some really concerning research that's identified high levels, high levels of toxicity in products, and they're sort of building on that and trying to understand the health impacts for that as part of the work on the international standards. So the international standards will be looking at, I believe, both the quality of products, which incorporates issues around toxicity, but also just around being fit for purpose. And it also looks at issues around what can be counted as biodegradable, and actually sort of specific requirements for that. But yeah, really important piece of work. And the Sanitation and Hygiene Fund and the Case for Her are doing a lot of work on that. But as Lillian said, this is an international standards, and then in some cases, country governments are actually ahead of that and they have their own national standards. But in other cases, once those international standards are in place, they can then be revised and contextualized for country-specific standards.
Thanks so much. That's really, really helpful, and really, yeah, really insightful too. I mean, yeah, as you say, shocking to hear that there aren't any international standards, hopefully. Yeah, as people advocate more for it, there will be change eventually. Okay, great. I don't know if anyone else would like to say something specifically about this. I saw, Delith, you unmuted before, but then yeah, I know we also have Mercy on the call, who we would love to hear from as well, just in terms of personal experience with people using, well, yeah, training people to use to sew pads as well. Yeah, sorry, Delith, did you want to say something?
Yeah, I was just going to add that African washable standards are related to each individual country, and therefore one of the key criteria for African washable standards, we're talking about reusable pads here, is that they are actually made in the local vicinity in that country itself. There are currently 2 international organisations working on menstrual product standards. One of those is driven by the British Standards Institute, and they are working collaboratively across with other global organisations to try and introduce standardisation for menstrual products in general, and that is currently in the developmental stage. And there's lots of different organisations that have joined that one. But as I said, there are 2 separate organisations working towards the development of international standards for menstrual products. So I'll just leave that there with you.
Great. Thanks, Delith. Okay, Mercy, would you like to share a little bit about your experience? Okay, I'm not sure she's... Oh yeah, no, she is. Mercy, can you hear me? I can see you put it in the chat as well, but you're muted in case we can't hear you. Well, she might have some technical issues as well. Well, if it yeah, you can always come in at a later point. I think we touched on biodegradable pads as well, and Lorna, who's here with us as well today, had asked a question about this last time. I don't know if she's with us still. Okay. Oh yeah, you are. Sorry, Lorna, I can see you now.
Hello.
Hi.
Yes,
How are you,
yes,
Lorna?
I am here.
Good to see
And I'm very interested to know what experience the group has with biodegradable pads, because most of the talk has been about the reusable ones. Our group, Donald Fermio, we're involved with various projects, mainly involved with young people in 2 areas of Uganda. And in 2015, we started to look at the possibilities of manufacturing biodegradable pads at schools. I think some of you who are involved with Uganda may know of the Maka pads, which were developed at Makerere University by Professor Musazi there. And we visited him, and he suggested that, yes, the pads that they make, which are based on papyrus and recyclable paper, could be franchised to schools. That was an idea which we liked, but then the costs involved, they were looking at large numbers of schools to be organized together. And so this put us off. And of course, what seemed to be, as I understand, government promoted reusable pads in schools, how to make them, etc. That seemed to take over, and so we didn't do any more about it, except that the reusable pads were being promoted and made by boys and girls at schools. But we have been concerned, and one of our colleagues is Esther Amulen, who is doing a PhD project on menstrual health in refugee camps in Uganda. And she's been a bit concerned about the hygiene of the renewable ones. She's very aware of the cultural problems over everything with many different groups. And for the washing of these pads to be hygienic, there's a lack of soap, buckets, and water. And often culturally, it's difficult for girls to sun dry the pads to be able to hang them out in the sun, which is ideal. And there's taboos against that, and ironing. And so if they can't be dried hygienically, we feel is a problem. So we have taken a renewed interest in biodegradable pads and whether they could be made locally with schools, for example. There's quite a good development. There's been quite a number of developments since we started looking into it. And the best ones look like from banana fiber or sugar waste fibers. The maca pads, which were the original and commercially produced ones in factories in Uganda, unfortunately, they say they are 95% biodegradable, but they still have a polyethylene, a plastic backing, which obviously isn't. There's other pads, mainly based on banana and sugar. Apparently, sugar fiber is more absorbent, but 100% biodegradable ones are available, and they're very big in India, I understand, and I don't see any reason why they shouldn't become so in African countries. Is anybody there? I did want to mention the product branded as Bana pads in Uganda, and we haven't been able to look into that properly, but that looks very promising. And they are interested in setting up what they call mini factories in remote areas. So that could involve schools.
Okay. Sorry, Lorna,
yeah.
I think we need to.
Okay. Yeah, sorry. I said too much.
Yeah, that's fine. No, sorry, it's just in the interest of time. We have to move on to the second part of the session soon. But maybe just to if there's any direct. Sorry, Marga, I can see your hand is up, and Mercy is back as well. So we'll need to probably maybe provide provide more resources later on this. If there's any really quick points on this, Lillian, before Marga and Mercy.
Okay, thank you, Lena. Mine is just to speak through what has been just submitted on biodegradable pads. Yes, I know about the MAC pads. At first, they came to join our period equality network. They wanted to do mass production. And like Shaz mentioned, it all comes back to the cost of production, but how also the affordability part for where they are taking them. I think that is the main issue that could not permit that kind of initiative to continue, because like our communities, even the kind of work we are doing, we have a big network of like organizations at grassroots level dealing with the context. The main issue there is more about dealing with the most vulnerable girls, government school aided. Maybe the biodegradable could be an alternative in like private schools. We can explore looking into that kind of perspective, because then the parents would be able to afford to procure to buy such pads for their children if we popularize it with the research that has been done. There is another lady, Kansime, I think, who is part of the Female Accelerator Program, who is also into biodegradable. I can also link her up to see how far she has come with this, because she was telling me that it is working. So maybe it will be good to follow up with her. Thank you.
Thanks so much, Lillian. Yeah, I definitely want to provide later on, enable people to connect with each other for further sharing and potentially learning more from others. Mariam, I can see you're back. I don't know if the network is stable enough now. You're muted at the moment. Oh, you're still muted. I don't know if it's possible to unmute. Yeah,
Okay.
can hear you now.
I was saying that I would really apologize. I'm terribly, terribly sorry. The internet just wiped me off from the stuff I've been trying since to
It's
to
fine.
get hold of you guys, and
No worries.
finally,
It's fine.
I'm really sorry. I'm really
Yeah,
sorry.
don't worry, please. Don't worry. Yeah, so we want to move to the funding section in a minute, but I'm just conscious because we had a hand up for ages and I don't want you to feel ignored. Marga, I don't know if you could keep it quick, that would be great, because we also haven't heard from Mercy. And yeah, so we'll probably have to cut a little bit into the second half. Marga?
Right. Can you hear me? Have I pressed the
Yeah,
right
we can hear you. Yeah, sorry.
Good.
And obviously, Mariam, you're back in charge. This is just to to let you know where we are.
Okay, it's fine. Yeah, continue. Carry on.
Go on, Marga.
All right. 2 quick points. When there was talk about international standardization, there is, I think, the challenge that large pharmaceutical companies then take over the production of pads, and the people who are most desperate, because we work in Uganda as well, Uganda's pretty popular, would would find themselves maybe squeezed out of a really important market. And that links up with what Lorna Brown was saying, is that you can have a standard all you want for reusable pads, but it's how they're washed and rinsed and dried in these communities that we are aiming for as well. So you can have perhaps a standardized pad to begin with, but anything can happen after that. And I think we all have to appreciate that. Second point, which was a quick one as well, is that I think that's wonderful going into refugee camps. We're also making contact with women's prisons as well. And I understand, when I was looking around at the start, that there are 32 women's prisons or women's sections of male prisons in Uganda. And so we are also going to be aiming for those, and it'll be self-made, hand-sewn pads. That was all I was going to say. They weren't that quick, blimey. Right, mute myself again.
Thanks, Marga. Okay. So maybe before we continue, Mercy, do you would you like to say something? Just to be mindful that we don't have much more time to talk about pads, I'm afraid. But yeah, we'd love to hear about your experience. Mercy, can you hear us? Okay, I'm not sure the connection is stable at the moment. I think we might have to continue for the moment, but we'll still be here, obviously, for half an hour. But maybe let's continue with the second part now. Mariam, I'll hand over to you again in a second, but I'll bring up the slides again to provide. Yeah, is that okay to provide the framing? 1 second. We talked about that. Oh, sorry, I'm struggling with the presenter mode at the moment. 1 second. Okay. So moving on to talk about funding. I just wanted to start when we talk about grant funding, because I think, you know, a lot of people that's what people are looking into. I just wanted to start by clarifying a little bit on Hub Cymru Africa's role and the kind of support that we can provide. I think most of you are aware that we do not give out grants ourselves, and we also don't have like a hotline with funders, but we do have funding opportunities on our website, as in we share other, like we have a directory, we publish available opportunities online, and we can also support you with identifying suitable funders. So you can use the directory to search, and then we can support you.
Lena, just say your presenter. We can see your notes. I mean, it's fine
right.
though. But in case you wanted to share the full.
Not what I wanted.
I'm just letting you know.
Thank you.
Easily done then.
Oh yeah, of course. I don't know how to change that now. Well, okay, that's how it is. Right.
Hello.
Right. Yeah, I just support you with reviewing and drafting applications. Now I can hear myself. I don't know.
It's Mercy.
Mercy.
Yes, I can get you well. Good afternoon, everyone.
Hi, Mercy. Sorry, we didn't. Sorry, I'll just finish what I just said, and then you can come in.
Okay.
Yes. Okay. So yeah, basically just to say that we are very happy to meet
Lena, something's happened with your. It all seems to be echoing. I don't know if that's for other people as well.
Yeah, I think maybe we should just mute everybody out. Mute Mercy.
Okay.
Do you want to make me co-host, Lena? Do you want to make me co-host?
Yeah.
Can we just ask everyone to mute themselves unless they're speaking?
Okay. I think everyone is muted now, almost. Sorry, I'm doing it manually now as well. But it seems to have disappeared. Yes, okay. I don't know. I guess interesting. I've never had that before. I'll have to keep an eye on that, where the issue is. Yeah, we're really running out of time now. Okay. I still want to, Mercy. I don't think we have more than a minute or two. I'm very happy for you to also share. Let's start it again.
Okay.
I think this might be the audio issue.
Yeah, thank you for giving me the opportunity to talk. I'm for Mercy in Cameroon. and I am the founder of Needful Children, and we do a lot on menstrual hygiene, especially on pad construction. And our main focus is mostly on training, because we realize that if we continue to like base our focus on distribution, the young girls will keep on depending on distribution, and that will not really help, because for how long are we going to give them pads? And again, with the limited means that we have, we will not be able to do so. So we, for the past 3 years, we engaged in training young girls, especially the IDPs and the refugees that are everywhere in Cameroon because of the crisis. We train them on how to produce these reusable sanitary pads, and so far we have trained over 3,000 young women, and we are proud to say that these young women are so happy in their homes. Some of them are producing and selling, which is giving them another additional income. And we don't only train them on how to produce this sanitary pads, we equally do a lot of sensitization and education on menstrual hygiene management, especially concerning the sourcing of the materials used for this construction of sanitary pads, how to use and how to take care of them. So if you see our packaging, the package that we have, we do have instructions on how to use and how to take care of them, because we realize that if we just keep training them on how to produce these things, and we don't focus more on maintenance, they will be using their resources on production, but they won't last. These sanitary pads that we are producing, because of the quality of the materials that we are using, they last 3 to 5 years. So they are really something that we are proud to say we are doing in Cameroon, and many people are so interested in it. Like now we have NGOs that are contacting us to be trained. So local NGOs, we are training them now on this pad production. And the good thing about this pad production and training is that the trainers that we have, rather the trainees, the young girls and the young women that we are training, they don't necessarily need machines. We train them on hand sewing. So what they need is we just train them on how that's the selection of materials, and what they need is just their needles, their threads, and everything is being done. So we believe that as we are coming together, the period poverty will be something that in years to come in Africa, I will not be hearing about it again if we keep on this work that we are doing. Thank you so much. I will have to come in sometime again, since you said we don't have enough time. Thank you.
Thank you, Mercy. Thank you. Do you mind muting now? Because I think it will help the... Yes, perfect. Thanks so much. Marianne, would you like to continue with, if she's with us still?
Yeah, I'm here.
Sorry.
Mostly apologize once again. This is all independent of, So yeah, it's really wonderful to join this session again this week, and the last one was really great, and I know this one also. I know I missed the first part. It's really unfortunate, but with this second part, yeah, we're going to discuss about about fundings, and I think it's a topic that is really really important, because people most likely there is this misconcept behind it, and I think there are questions that we should ask ourselves in order to know what should be done to have access to funding. because based on my own experience with everything going on in Dubrika and in Guinea as a whole, it's I would say on my side it has been a little bit difficult, because when you go towards some organizations or some social enterprises that might help fund the activities on the ground, sometimes we use the wrong approach. Sometimes we are kind of confused on how to deal with it. So I think there are questions that we should really ask ourselves, you know and I would really like to ask these questions to the participants, like you know but really, what does financial sustainability mean, firstly? And secondly, I would say, when does a social enterprise model work, and when does it not? I think those are questions that we should really ask ourselves. And what are the approaches, that the effective approaches that could be used in order to make sure that we have access to funding, and how can, of course, organizations collaborate more effectively. So yeah, these are questions that I would really like us to talk about, and then see what can be done. Yeah, so I guess I will have to invite someone to speak about it. Um, yes, Mrs. Tabitha Jai, yeah, from the Waterloo Foundation. If she can mention something regarding this. I'm not sure whether she had intervened about it while I was absent, but since this is the second part and it's mentioning funding, yeah. So I would like to give her the floor, please, for her to share her own perspectives.
Thanks very much. No, I hadn't spoken on this as yet, so just moving into the funding part of the presentation or the workshop today. So yeah, thanks ever so much for inviting me to speak for just a little while. I'm here representing the Waterloo Foundation, a family foundation based in Wales and based in Cardiff, which some of you may already be familiar with. And we do support some menstrual health and hygiene work. So Lena had suggested a couple of points to speak to, which I think overlap with some of these questions on here. So yeah, just to sort of share some thoughts or some considerations, and then open up to others as well for any questions or your own thoughts and experiences. We're still very much learning in this area, and keen to hear from others, and today is a great opportunity to do that. So in terms of the funding that we give in menstrual health and hygiene, we are reviewing the strategy at the moment. So over the previous years, more of our funding has been in the form of small grants. It's sat under our WASH program, and so it's been focused more on menstrual hygiene, thinking about the hygiene facilities that are necessary for safe menstrual practices. But this is increasingly moving across to think more about this more broadly as menstrual health, and thinking of menstrual health as a matter of human rights, and moving that more into our main grants program. As I said, we're still sort of refining strategy, but I would say the areas that we're particularly interested in are around fostering enabling ecosystems for market-based approaches. So this speaks to efforts such as what we heard earlier around standards, around tax reforms, around thinking about grouped procurement processes, and then also supporting intermediaries in technical, financial, and market support of enterprises, but focusing particularly in areas where there is potential for well-functioning markets. And this does tend to to not be emergency or humanitarian contexts. So I think one of the questions was around when do social enterprise models work and when do they not? I think it's important to highlight that it won't be appropriate for all areas. And emergency or humanitarian contents are one example of that. So what funding we currently have, or sort of just to give some examples of some grants, we've been funding iRise for a number of years, so lovely to see Lillian and colleagues on this call, particularly around strengthening the period equality network, network of a couple of hundred now grassroots organisations, and we feel like really strengthening this network and ensuring that members have both access to information, but also a seat at the table to have a voice in shaping policies and decisions made at higher levels is really important to make sure that the end result is relevant to the end users. We're also funding a grant with UNICEF. This is more around shaping the menstrual health and hygiene landscape. So this is a framework for menstrual health and hygiene system strengthening and piloting country roadmaps in this. And we're in discussions at the moment for a grant with the Global Menstrual Collective, or the GMC, which is hosted by WaterAid. And this is relating to their work on a political economy analysis in menstrual health and hygiene, and then using that to develop, or building on that to develop a shared agenda for action. Maybe just, I think you also asked, and I know I'm conscious of time, so please, Lena, break in if it's more helpful to stop and open it up to others. You'd asked.
Yeah,
Oh.
I just have one question that I think is really important. What do you think makes an application really strong?
Yeah, I think there are a number of factors, but maybe a couple of key points are that organizations should really think carefully. Maybe this is particularly thinking about, because we fund very different interventions, but focusing in on organizations that are working around pad production, maybe. It's important to think not just about fixed costs, but also around the ongoing operating costs. It's really important to think about choice for women and girls, so a choice of products, and also quality assurance. And I think also just thinking carefully around how grant funding should be applied and used. So I think in the case of entrepreneurial efforts, thinking that it can be used to subsidize commercial funding, so such as loans or equity, or otherwise directed at activities more related to the social outcomes like government advocacy and behaviour change. So I think there's some really key points that we'd want to see within applications that we're looking at. And then maybe also, if you're looking at the market sort of piece, that it might not be actually organizations that themselves are producing pads, but it's around how do you remove the structural barriers to enable the growth of markets and sustainability of markets. There's a really important piece of work there.
All right, Tabitha, thank you so much for that. That insight is really incredible. Incredibly valuable. Thank you for that. And I think now we're going to open the floor for some questions. Okay, and I would like to encourage participants to to keep questions concise because we don't have much time now. So does anyone have a question maybe for Yeah, for our participants, please, could just maybe raise your hand and yeah, we give you the floor. Does anyone have questions, please?
Hi, Mariam. I had raised my
Hello.
hand.
Oh, Lillian, okay, go on.
Okay, thank you so much. Just to say thank you to Tabitha for sharing insights on funding modalities for a good initiative. I just wanted to share from my experience, having worked with the Waterloo Foundation and Tabitha as a focal point through the different processes that we go through. I think I find it as very engaging to focus us into having to think about the impact we want to create. Like she has mentioned about the ecosystem, how we put the different pieces together to fit within what is working. I think I've found that more empowering in the design of the different proposals or negotiation that we have had. And with the Period Equality Network, since 2021, Waterloo has been funding some grassroots organizations and diversifying funds from the well-able organizations that are good at writing proposals to the grassroots where the real need is. And we have seen over the years the impact it has created within the communities where these small organizations are based. We are across East Africa, so all in Kenya, Rwanda, Tanzania, Uganda, we are seeing that we are moving together and there is more recognition how if we work together, then we are shaping the period equality that we want, that we are trying to advance for at the different fronts. Some of them are social enterprises, like I mentioned, some of them are into education for menstrual health, some of them are into policy, around policy issues that affect the girls and women. And we have kind of come to realize that, like last year, we went through a process to redefine, like to re-strategize the direction that we wanted to undertake. And we were able to work through a consultant who engaged us to look beyond what we were just trying to focus on. And this, I think, was more empowering. So I just wanted to add my voice to the approach that Waterloo takes to engage, understanding the dynamics on ground, but also how we can come in to kind of work around the solution we are trying to promote, looking at the greater impact. Thank you.
Okay, Lillian. Thank you so much for that. We don't have much time, but I think we can create room for one more comment or question before we close up. Does anyone else wish to say something? Okay, Sue. Okay, go on, please. We need to be.
Okay, I'll be very brief. So I run a very small charity in rural Zimbabwe. We're trying to get into the local schools to for them to make menstrual pads. They've got sewing machines. They have no money, and we have no money to buy the material. And we've approached the local Rotary Club in Victoria Falls, but they haven't come up with any money yet. So are there grants available specifically for schools to make pads? I don't think we would have probably any quality control. That's the trouble.
Sorry, is that directed to me or more broadly? You're on mute, Sue.
Sorry. Well, it was for anyone who, yes, Tabitha, perhaps you could answer that. Thank you.
I think, I mean, I can speak, but it's maybe initially for the Waterloo Foundation that we do fewer of those small grants for cottage industry pads, just because of the limitations in sustainability and in scalability. So we are prioritizing some of the other efforts that I was speaking to earlier. But I would say the sort of organizations that you have approached they do consider those kinds of funding. So Rotary and some other small funders. So I would encourage you to keep looking. But think around, as I said before, really think through what are the costs of producing yourselves. Don't necessarily assume that is the most cost-effective method compared to looking at other products that are available in markets, or thinking around education to go alongside that work as well. But yeah, others may well have other valuable insights into that.
Thanks, Timothy.
Thanks again. Not sure. Mariam, are you still with us? Uh, well, maybe to cover for the minute. Well, we should probably wrap up in a minute. Maybe if there's one last matter, which is I was keen maybe to touch briefly on collaborations on that point, and kind of just to bring that up, as I know that there's a lot of potential in that, and it can be in the context of funding, like, I don't know, joint funding bids, or more broadly speaking about sharing, joining forces. I don't know, Tabitha, if there's anything you would like to say on that, or others, I think, and then we'll close after that.
Happy to jump in with a couple of thoughts just quickly. I think that collaboration hits one of the key challenges in the menstrual health sector on the head, because it's really recognized how fragmented efforts often are, partly because it sits across different sectors. Some people come at it from a health perspective, some people from an education perspective, others from the sort of entrepreneurial perspective. And so bringing these together into sort of a united efforts can be quite challenging. But just to give a couple of examples of what is happening, I mentioned work being done at the moment by the Global Menstrual Collective. So this is really around pulling together a shared agenda, which is to guide a more united front for advocacy pathways. So I think for people, it may be worth just following up, having a look, seeing what recommendations come out of this to align with those, and see what efforts are being made for there. And then, maybe just sort of, well, we've already spoken about the Period Equality Network today, so I don't want to go into detail, but this is a really collaborative effort. It's got, I'm not sure, going on 200 organizations within this network. And then iRise is hosting that so that they can share, so that they can provide a platform to share information across there. The microgrant rounds that are open to deepen members and others. They are looking at how this can be done more strategically, so that it's not sort of single grants operating on their own, but how can they come together so that sort of brought together they can either provide really valuable insights into or sort of fill evidence gaps together. So going on 300 now. So these are some examples of collaborative efforts that might be worth keeping an eye on.
Great, thanks so much. We really need to come to an end now. But yeah, really useful information there. I'm just going to bring up my slides one more time. If I can manage to go to the appropriate slide. Well, basically, I would like to follow up with some resources. Some of Emma has put some in the chat as well, but there's more links and more I think resources, organizations online and initiatives that would be useful for people to learn about and know about. So I'm going to follow up with that, and then I also wanted to mention that, yeah, I'd love to help people to connect with each other. So I'm going to, yeah, share contacts. If you did agree to us sharing your contact, I'm very happy for you to include you in that. So just to make it easier for those that are interested to connect with each other afterwards. So we'll be following up. If you're still on the call, for those that are still here, before you leave, I'm really grateful if you could fill in the poll that I have launched. I hope it's still it is still visible. Can I get a nod? Emma, can you see the poll still? Yeah, okay, great. I'll give you one more minute. Otherwise, I just wanted to really thank you all, and thank you, Mariam, in particular. I don't know if your network is stable enough to come in again. Sorry for taking over. It's difficult to tell whether whether you can speak or cannot speak because you're here, but I don't hear you. Yeah, it may be unstable again. But yeah, if you can hear me, thanks so much for sharing today, and thanks to everyone who came and contributed. And yeah, we'd love to hear from you. And also, I should have said that if you have resources that you think might be useful for others, please let us know, share them with us, and I can include them in the mailings. Okay, just to say that. Perfect. Okay, great. Thanks, everyone. I don't think I've officially stopped the poll. I will do that. Yeah. Okay. Thanks, everyone, and have a great
Thanks,
rest.
Liam. Thanks, everybody. Bye-bye.
Thank you. Bye.
Thank you.
Bye. Thank you.